What labs and imaging will a rheumatologist check when you first meet them? Hello, this is Dr. Siddharth Dambar, physician and board-certified physician in rheumatology, as well as expert in regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. All right, let's say you've been referred to a rheumatologist. What can you expect when it comes to the kind of testing they may be ordering for you? Well, it usually depends on what you're presenting with. So rheumatologists are classically seeing people that have either inflammatory arthritis or autoimmune conditions. This basically means where your immune system is attacking your own body, maybe causing inflammation in the joints. So, for example, let's say you see your rheumatologist and you're presenting with pain and swelling in the joints. They're likely thinking that you may fit into a few specific diagnoses. And based on that, they'll probably check some labs specific for inflammatory arthritis. That can include some antibodies for rheumatoid arthritis, some other autoimmune issues as well. They may check your uric acid level if they think you could have gout. And then they may also check some imaging. When it comes to imaging, your rheumatologist will likely order some additional imaging testing based on how you're presenting. X-rays are the typical first-line image modality that's checked, in large part because it's fast and easy to get done, low cost, and in some cases, if you've had a chronic condition, can actually show if you have significant damage that fits with a classic diagnosis. Frequently, X-rays will be normal if you've had a condition more short-term, in which case other imaging modalities may be more beneficial. My own practice, my preference for inflammatory arthritis is to utilize diagnostic musculoskeletal ultrasound, where we're able to look at the joint, the tendon, and look for any inflammation. Very helpful, very fast, easy to do at the point of care, meaning while you're at your visit, can give us really quick acting diagnostics that we can then help to make a diagnosis and then push you in the right direction in terms of treatment. Sometimes they may actually do an MRI if they're looking for inflammation, or let's say they're looking at the spine and they're looking for inflammation. That can sometimes be helpful as well. Now, there may be other autoimmune conditions your rheumatologist may be suspicious for, let's say lupus, Sjogren's, vasculitis, or a related condition like that, in which case there's a different set of antibodies that they'll likely be checking. In addition, let's say you have a specific organ system that may be affected. Let's say you've got shortness of breath and they have a concern you may have one of these other autoimmune conditions. Well, they may need to check some additional imaging of the heart and the lungs as well, depending on how you're presenting. What drives really all of your next set of tests is really what is the clinical suspicion that your physician, your rheumatologist has when they're meeting you. So when we say, or when I say clinical suspicion, I'm referring to the following. Your physician should be listening to your history. What are your symptoms? How long have you had it? What's your family history? How things progress? That should give them some clue as to what might be going on. They'll then, based on your examination, help to fine-tune that diagnosis further or that suspicion further. So as an example, let's say you have significant pain and swelling in the hands and the wrists. Might make them think more likely rheumatoid arthritis. On the other hand, let's say you have some classic rash on the elbows, behind the ears, that looks a little bit more psoriatic. Maybe they're thinking more psoriatic arthritis. Or maybe you've got a classic sort of rash across the face that looks more lupus, might point them in a different direction. So based on that history, based on that examination, it gives them a more solid base to create that kind of clinical suspicion. They may also look at some of your prior records that may help to clue in what they can rule out, or maybe what kind of pushes them in a direction as well. Based on that, ideally, they should then direct their next steps. Based on that, they should then decide what are the next labs to check. And then also, is there additional imaging? Maybe you need a biopsy. Is there any other doctors that you need to see? But based on that clinical suspicion, that's what takes you to the next level. Key is that you never, as a rheumatologist, you never want to take a spray and pray approach. And by that, I mean that they're just checking everything under the sun. As a patient, it may feel like your rheumatologist is checking a lot of tests, and maybe they are spraying and praying. But the reality is, if they're coming into it with a clinical suspicion, that'll help to direct what they're doing. And you need to understand that lab testing on its own does not give you a diagnosis. It just needs to verify, solidify, and agree with the clinical suspicion. And the reason why is because labs do not always correlate with a diagnosis that a person has or severity that they have. You have to look beyond just lab tests or just one test that may be positive or concerning. So looking at the whole picture is how they're going to direct things. For suspicion for inflammatory arthritis or autoimmune conditions, they're most likely going to check some labs, possibly some imaging as well. And all that will help them, your rheumatologist, get closer to a diagnosis to then be able to guide you in terms of treatment and management to getting you to feel back to normal and to control your condition.